Ladies and gentlemen, hospitals are running out of space. And those of you that like to come over here talking about the hospitals are empty, there's nobody in the hospital, I'm blocking you. Okay, I got family that works in hospitals and they're telling me what it's like. And you're sitting there talking about the hospitals are all empty. You know how retarded you sound? First of all, the flu season alone will send a lot of people to the hospital. And they think because they saw some video of an empty hospital back in March, they're still empty now. Please stay off of my channel with that stuff. If I see it, I'm going to block you. And I don't care who you are. All right. So this is CNN. Hospitals stretch beyond reasonable limit as number of COVID-19 patients reaches 100,000. So this is December 2nd, 2020, CNN. The numbers are grim. More than 100,200 patients were in U.S. hospitals Wednesday, according to the COVID Tracking Project. There were more than 2,670 deaths reported Wednesday, according to Johns Hopkins University. Those totals never been higher. The stress on frontline healthcare workers have never been greater. One county in Wisconsin told CNN our hospital ICUs and emergency rooms remain stretched beyond any reasonable limit, and our healthcare workers, as well as our patients, need our help. And the head of the Center for Disease Control and Prevention said Wednesday that these next 3 months will be the most difficult time in the public health history of this nation. After they are authorized by the federal government, coronavirus vaccines should help. This is, the federal funding. And, that's a damn shame. A pandemic is going on, and these places got to beg for funding. It should be automatic during a pandemic. You got to beg for money. And we know the public have not gotten a dime from the politicians. See, this is their job. This is what they're supposed to do, take care of the funding. And we see they are just sitting there wasting everybody's time. They need to take their behinds home if they're not going to work. And I would also recommend giving them a cut in salary for not doing their jobs. Right now, the situation in places like Dane County, Wisconsin are dire. Dane County Executive Joe Parsi said, he told CNN, resources are alarmingly stretched thin as medical facilities are nearing capacity. And this was the worst of the pandemic. So, ladies and gentlemen, they said the hospitals are 98% full across the US. Our numbers are pretty out of control right now. Hospitals are trying to work through the crisis by finding new places to care for COVID patients. I think COVID patients should be in a separate facility. I don't think they should be mixed in with people at the hospital at all. Some are being treated in a children's hospital. Wow. Some patients are being seen by doctors who are working outside of their specialties. Many healthcare workers are signing up for extra shifts. Other hospitals are facing similar demands. And while those facilities have been stretching capacity by opening new areas, creating more double occupancy groups and rooms, bringing the staff from outside of its system. So I guess they're doing everything they can. So that's in New Mexico. So they're trying to even bring people from the outside into the hospital for help. When you run out of resources, whether that's doctors or nurses or beds or ventilators, you cannot give the best care. We are not there yet, but we are very close as a state. So they're talking about the high level of stress on the healthcare workers. Yeah. The number of COVID 19 patients in the US hospitals will stay high for months, the CDC top official said Wednesday. The reality is, December and January, February are going to be rough times. I actually believe there's going to be, those months are going to be the most difficult in public health history, largely because of the stress that's going to be put on our healthcare system. Dr. Robert Redfield. Daily coronavirus cases and deaths have been soaring. The US averaged 161,448 new cases daily over the last week, nearly 2.5 times the summertime peak in July. The country's daily average of COVID deaths across the week is 1,531, above its summer high around 1,130, but lower than the pandemic peak above 2,240 in late April. But as coronavirus hospitalizations rise, the number of daily deaths are predicted to get worse, with various experts recently warning that it could regularly surpass 2,000 and 3,000 and perhaps 4,000. Health experts say they expect cases and hospitalizations to swell further in the coming weeks when infections from Thanksgiving gatherings start to manifest. That should be about a week, next week. And the CDC, like it did for Thanksgiving, is recommending that people postpone travel over the upcoming winter holidays, and they're not. They didn't listen during Thanksgiving. They're not going to listen during Christmas either. I read there was over 9 million travelers um, for Thanksgiving through airports. So folks are not going to listen to the warnings. It'll go in one ear and out the other. The world appears to be moving closer to, the vaccine. The UK on Wednesday became the first Western nation to approve one. So they're supposed to be rolling out doses next week in the UK. Two companies are preparing to ship out vaccines in the United States, anticipating the Food, Drug, and Administration will give them emergency approval this month. So, they are so excited over these vaccines. And like I said, I don't believe they're going to work out like they're claiming. I really don't. You got to look at history when it comes down to vaccines. You have a lot of people, and I'm one of them, that took a flu vaccine back in the day, and many people got sick from those shots. And usually, once a person gets sick from taking a vaccine, they will never go back and take another one. They will not go back and take another one. And this is exactly what's going to happen with that COVID shot, because I told y'all about the side effects, and they're talking about giving people multiple shots. So if they get so sick that they can't work and they're having headaches and they feel like they're hungover and having all kinds of issues after getting the shot, they ain't coming back for that second shot. They're not. People are not going to trust no second shot. And I can't believe they would go out there and get the first one, but we know there's always somebody that's going to go out there and get that vaccine. Always. So, ladies and gentlemen, so they're saying in the US, as long as they get authorization that they need, should be able to send shipments out of the vaccines between December 15th and the 22nd. By February, 100 million Americans could be vaccinated. I don't think so. Operation Warp Speed advisor said on Wednesday. I don't see that. I don't see that. And y'all know it's a needle shortage. And they're already saying with the needle shortage, they're going to be limited on how many vaccines they can give to, the public. There's a needle shortage in America. And in fact, I did an article. There's not even enough needles to give the flu vaccine. That's how short they are in needles in this country. So it's not going to go the way you think. I mean, isn't that like the Most High when they're getting ready to give a vaccine out? He makes sure there's not enough needles for them to give it to everybody. Oh, man. Mm-mm-mm. The United States has said if Pfizer and Moderna win FDA emergency use authorization in December, they could distribute 40 million doses of the vaccine by the end of the month. Each vaccine requires 2 doses, so that's enough to fully vaccinate 20 million people. And they're claiming they expect 60 million to get the vaccine by the end of January. Well, good luck to you. Good luck to you. That's all I got to say. Y'all, please tell me what you think. I just see this thing getting worse. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I'll see you on the next video. Peace, family.